wonderful good day to you. This is Owen McCafferty speaking on behalf of Professional Fusion. Thanking them for their kindness to present this video. I'd like to talk with you just for a few minutes. And as you can see, it's a Saturday morning. I am dressed casually. Usually that's not a problem because no one is in the office. Or if I do talk with clients, they understand that Saturdays is a day where you're given an absolution from wearing classic business attire. So I'd like to entitle this short little narrative, Preparing for Surgery as a Practice Owner. When you're a practice owner, you live and breathe and think and worry all the time about your practice. It would hold that way for anyone who owns a business, either a large business or a small business. The responsibilities that you have, not necessarily just to make a profit, but the responsibilities that you have to your clients, to your patients, in the case of a small business, to your customers, is overwhelming. And I brought this up as a topic because I couldn't sleep last night. And the reason I couldn't sleep last night was because I'm preparing for the inevitable left knee surgery that will occur for me this Wednesday. And I know that it's going to be a period of time that I'll be out of the office. And for those of you that know me, you know that mobility is an assumed luxury that I have. But this unfortunately is going to immobilize me. So I'm trying to get as much as I can done as quickly as I can and trying to make the period of time that I will not be available in the office hopefully at a minimum, as painless as possible for those around me, both in honoring the wishes of my clients and my obligations and duties to my fellow workers. So when you're going through the process, I haven't really seen too many videos that speak to practice owners or even small businesses preparing for a surgery and then what you will do before you're literally placed under the knife, especially a surgery such as a knee replacement, where there's going to be a period of time where you won't be able to be in the office. So I thought I'd just throw this out as an idea, as a thought, give you something to think about, because we're all going to have to be dealing with it. Many of you that are watching this video already have. And you know something that I don't. And I am envious of you. But in the words of John Hume, experiential knowledge is a wonderful thing. And I'll be experiencing that on a short period of time. So it's not as bad as it used to be to maintain contact at the practice. You have devices such as the one that I'm using right now, the magical iPhone, that allows me to be able to see people, to digitally send messages or emails, and to possibly by FaceTime be able to see not only the person with whom I'm dealing, but also the office as a whole. So it's a lot different than what it was in the old days, and the technology is going to help. Also, there's Zoom. I can conduct some client meetings on Zoom, and providing the pain meds are kicking in and working just fine, it'll be a transparent activity. I'll know more after, and I'll file up a subsequent epilogue on what occurs after the surgery. But I just thought I'd throw some ideas and thoughts preceding to the point with you, because many of you are probably going to be going through the same thing. They say in your 60s, 50s or 60s, you have a challenging either illness or surgery, and then it crescendos up from that point forward. I'm long overdue. I'm 71, and I really have not had a surgery or a procedure that interrupted for a long period of time. Probably the most challenging one I had is when I had my cataract surgery, and frankly, that was not bad at all. In fact, I would consider it to be a piece of cake. I'm hopefully going to file a report with you after and let you know that the knee replacement really isn't as bad as they tell you it is, but I've got it from pretty reliable sources it's going to be. So technology is going to help quite a bit. In the medical professions, obviously you can't be in the exam room and the surgery suite as well as at home recovering at the same time, unless you're Padre Pio. And there was only one person I know that had that in recent times, the ability to be two places at once. And it's going to take some planning and logic. The transportation is also going to be a factor. You have to make sure that you have the capacity to be transported, because you won't be able to drive on your own, at least while you're under the influence of opiates. The other factor that you have to consider is the type of vehicle that you're going to be driving. Now, many of you know that I'm a very proud owner of a 2007 Acura TL Type S with really great 6-speed transmission, manual of course, and my left knee is going to be needed to operate the clutch. So I may have to be borrowing a car from someone else and who can also drive stick, and let them drive my car while I drive their car, at least until the knee is healed. So in planning, in trying to understand what's needed, there's a lot of demands, and you have to interplay that which isn't really known yet. Now, many of you in the medical professions already know quite a bit. In fact, you have a better knowledge sometimes than the people that will be actually performing the procedures. Different species, of course, but you'll be very knowledgeable. There'll be some things even for you, the great savants, that will be a surprise. So you just have to anticipate that and then welcome it. Sharing the knowledge, I think, is important too. Letting people know after you've had the procedure what you did, really trying to remember how you would do something different. Now, I have the advantage because my right knee will have to be replaced at some point, and I'll at least have the experiential knowledge of that which occurred precedent. So it's going to be an interesting time. I won't be filing as many webcasts, at least over the next few days, because it's going to be a challenge. I'm looking forward to it. It's an adventure. It's an opportunity to experience something that I've never really experienced before, but I do worry about the practice as any practice owner would. And it's okay. It's much better today than it ever was in the past because of technology, that you can still stay connected. So with that in mind, this is Owen McCafferty. I want to say thank you very much. This is more of a therapeutic narrative for me. Oh, by the way, I did take physical therapy, and it did a phenomenal job, to the point where it's always a hesitation. Do I really need the surgery now? I had a great physical therapist. She's going to be helping me after, hopefully to get full extension of the knee and to be back on the road again. So this is Owen McCafferty. I'd like to say thank you very much, and hopefully you don't have anything facing you in the near term, but if you do, just remember these short notes and possibly even record them. Talk to you in a bit. Take care.